Hi, Dr. Dan Moquin, Parry Family Health Team. Today I'm going to cover a topic of what to expect when you come to the family health team. When you come in the front door of the building, you're going to be screened, and there's a couple of red X's on the floor, and they're going to want you to keep your distance there, and they'll ask you a few questions. If you're past screening and you're coming into the building for a blood test that's been pre-scheduled, or a physical exam, or a visit with one of our nurses that's been booked ahead of time, you will be asked to wear a mask and do some hand sanitizing when you come in. If you do not pass screening, or you're just dropping off a form, or making a quick inquiry at the screening desk, you can just go back out the doors. Once you're in the building, we are trying not to use a waiting room model. We're going to get you to go have a seat in your car, and we'll call you on the cell phone, and then as soon as you come back in after you've been screened, you will be brought right to the room where you will have your interaction with your caregiver, your nurse practitioner, physician assistant, physician or nurse. So you'll see that the staff is doing distancing. We're trying to stay 6 feet apart. We're doing frequent hand washing. When you come into a room, it will have been sanitized prior to your arrival, and it will be sanitized after you leave. We're doing frequent hand washing. Most practitioners are choosing to wear a mask during all our interactions with anybody who's coming through the door. If there's no patients in the building, we don't tend to wear masks, but we are self-distancing, as mentioned. Be prepared for things to take a little longer, and be prepared for non-essential medical things, referrals, tests to be deferred until the pandemic improves. So that's kind of the day-to-day process. We're still, I think, functioning at full capacity. All our staff is here. Physicians, nurse practitioners, physician assistants are making phone calls along with the nurse colleagues, and we're seeing people in person who need to be seen. So the best way to contact your physician or your nurse practitioner is to call in, book an appointment for a phone call, and if we determine that you need an in-person exam, we will make that happen for you. And hope that's helpful, and thank you for maintaining physical distancing and keeping our area relatively COVID-free.